Middays, hour two of the program in the Element Wealth Studios. Joining us now, Dr. Mark Horne, Chief Medical Officer of South Central Regional Medical Center and past president of the Mississippi State Medical Association. Welcome, Dr. Horne. Good to see you again, sir.
Nice to be on. I appreciate it.
Yes, sir. So we've been talking quite a bit on the program about the state of health care, specifically the healthcare economy in the state of Mississippi. Dr. Edney from the State Department of Health has warned that numerous hospitals in the state are struggling financially, particularly those in rural areas, some of which where the situation is dire, and they're at risk of shuttering those facilities, which would leave those regions of the state without a major health care facility. What's your take on all this at this point, Dr. Horne?
Well, if the healthcare system of the state of Mississippi were a patient, and the people of Mississippi were the family, and they were in the waiting room at the hospital, and I were the doctor, and I was going to come out and explain to them how their loved one was doing, I would have to say that the patient was in critical condition, the situation was dire, and there was great risk of really terrible outcome. And it's something that we've seen coming for some time. The Mississippi State Medical Association, a variety of physicians, and I know I'm friends with a variety of people. As the administrator at our hospital, chief medical officer, I'm familiar with the hospital association and what our CEO goes through and our management team go through. We've been telling people for a long time. We've been telling our legislative leaders for a long time, this is a problem. It's getting worse. Something needs to be done. Well, here we are, and the crisis has arrived. The patient is in critical condition, and it is time, far past time, to take care of the problem.
So there are some legislation, some bills, I should say, that are still alive in the legislature this year to address the situation. I guess one in particular from the Senate, 2372, is a program that would provide $80 million in grants to hospital based on licensed beds and some other information pertaining to the facility. I wonder about that, though, Dr. Horne. When you look at the losses being sustained and the negative cash flow being incurred by Mississippi's healthcare institutions, this is a drop in the bucket, but this isn't a plan to sustain these hospitals on a long-term basis. This might just be some sort of very short-term fix for a handful of them. But heck, Greenwood LaFleur Hospital, based on the published audited financial statements, lost $20 million last year. $20 million on about $105 million of revenues. Well, heck, that's a quarter of this $80 million for just 1 year.
And so you're correct that these bills, crucial though they are simply a temporizing measure. Again, if we go back to the illustration of the critically ill patient, when you've got a patient who's critically ill and you're going moment to moment to try to get them to survive, you do what you can, even if you know that that's temporary, even if you know that's not going to win the war. We're trying to, right now, we're trying to keep the patient alive. And in this case, we're trying to keep alive. I'm not arguing for the individual merits of any of these bills as a standalone. What I can say to you is we have a critical problem in the state of Mississippi that needs to be dealt with aggressively. There may be some temporizing measures, inadequate for the long term, though they may be. But if I worry about what's going to happen 5 years from now, but I die today, I haven't accomplished anything. So we've got some short-term work. We've got some long-term work. We've got both. Short-term, we've got to keep some places alive. Short-term, we've got to improve the environment as best we can. And then long-term, I think the lieutenant governor's right. He's on public record as saying we've got to fix the long-term structural problems in our healthcare provision. One of those is to take full advantage of, to access all of the revenue that's available for our hospitals. I heard somebody say the other day that Well, Medicaid expansion, well, you lose money on Medicaid patients, so why would you want Medicaid expansion? Well, if we get $0 for a patient today that comes to our doors that has no insurance, that has critical illness that needs to be taken care of, that we are legally required to do, and we are happy to do that, then at least we would get something. Currently, our small hospital here in Laurel, licensed for 275 beds. If we get 130 to 160 if we get 160 patients in the hospital, we're full to the brim. But we write off several $1 million a month in free, uncompensated care. And I don't know of a business. Ask any businessman you talk to, will they do that on an ongoing basis? And so we've got to take advantage of the monies. I'm a physical conservative, and I understand the arguments against the Affordable Care Act. The challenge is it's here to stay. It's not going anywhere. The last decade plus has proven that. And over $1 billion a year has been passed on by the state of Mississippi, and that's money that we could use. And even that won't solve the problem. We've got issues with insurance companies. I had a situation within the past couple of months. Chart review came back to me, a care that we had provided a patient 2.5 years ago. And the insurance company agreed that the patient needed to be admitted, agreed to pay the money, paid the money, and now they've outsourced those charts to a third party and said, hey, we'll give you some money if you find something that we can deny retrospectively. And they've sent us a demand for repayment of funds they paid us 2.5 years ago for stuff we did 2.5 years ago. Why is that legal?
Yeah.
We are getting continuous downgrade. We turn in charges for services rendered that we did, that we documented, and a computer system or automated reviews denies the charge code, downgrades it, and we have to appeal. So we have to hire employees, spend tens of thousands of dollars to get them to do what they know they're supposed to do, but they don't do it because they know they can get away with it. Some people won't.
So, Dr. Horne,
we've got all kinds of structural problems.
Yeah, something else that we probably should just share is that the disproportionate share payments, their acronym DISH payments, I know you're very familiar with that, which are federal monies designed to cover and reimburse healthcare institutions when they have sort of an outsized amount of Medicaid and I think even Medicare patients as well because of the low reimbursement rates. But there's some reductions scheduled to go into effect later this year, which is going to put even further financial pressure on hospitals. Your thoughts?
Exactly true. And one of the some of the machinations in this are complicated. But because of the Affordable Care Act, they took money away from one aspect on the guarantee that they would send the money through if you expanded Medicaid. So money that we lost money by not just by not expanding Medicaid, we lost money from reductions in payments that we would otherwise receive. So we've got a double whammy, and then things like you just mentioned. So I understand the principle, but the reality, and look, the business community in Mississippi gets this. We've got some political leaders who I understand, I think I understand some of the politics, but the reality is bigger than the politics here. They've got to understand the reality is the health care for the people of the state that they love, that we love, is in dire straits. And leadership has to be taken, and it can't be kicked down the road. This can has been kicked as far down the road as it can be. If something is not done in this legislative session, we will lose some things that we will not get back. And some of that will be some lives. I can't tell you how many, but there will be lack of access to care in parts of the state, and people will suffer. Some people will most likely die. If you look at the statistics, I'm not trying to be alarmist, but it's just hardcore facts. And when that happens, you won't be able to bring that back. When you lose a hospital in a rural community, you will not bring that hospital back.
Dr. Horne, we're up against a break right here. Can you hang around with us, sir? This is, I think, a meaningful and valuable discussion. Can you hang with us?
I'll be happy to.
We got a break right now in the Element Well Studios on middays. Dr. Mark Horne, Chief Medical Officer at South Central Regional Medical Center, is our guest. Stay with us. On middays, SuperTalk Mississippi, Dr. Mark Horne, Chief Medical Officer, South Central Regional Medical Center, past president, Mississippi State Medical Association. We're just discussing the healthcare situation here in the state of Mississippi. Dr. Horne, this seems to be a nationwide phenomenon in that there are numerous healthcare institutions, some very prominent, well-known across the globe, that are reporting negative cash flow in their operations. And our situation in Mississippi may be a bit unique in that we have a dispersed population and we have a lot of facilities that are located in rural areas where it's even more difficult to produce a positive cash flow because of the number of uninsured and number on Medicaid. They're generally impoverished areas. And that just means there's less revenue to obtain from the patient customers, if you will. Is this your way you're seeing it as well?
Yeah, this is you've got it exactly. The problem is widespread. It's national. I don't pay a whole lot of it. Well, actually, I do pay attention to some of the international stuff. You look at Great Britain, and they have tremendous trouble with the international
terrible
sale.
Yeah.
So there are problems across the globe. The problems in the United States are widespread. They are accentuated in Mississippi because we are the poorest, most impoverished state in the nation by many measures. We are rural, which adds an additional challenge, as you acknowledged and noted. So the other thing is we're competing in a nationwide labor pool. So our nurses in Mississippi are, for one example, and the entire healthcare team matters. And I've been talking a lot about hospitals. I'm a member of the State Medical Association. So as a physician, we face a lot of these issues in our private offices. But hospitals and physicians are hiring nurses, and we're hiring clinical assistants, and wages are up everywhere. Wages are up, but our reimbursements aren't up. So we're getting tremendously squeezed there. And unlike some businesses, we have zero pricing power. We don't have the ability to set our reimbursement rates when we're working with insurance companies, when we work Medicare, Medicaid, even private insurances, they set those rates. And since they don't adjust those rates and our expenses went up, there's nowhere for us to go. And hospitals in particular are mandated by law, and I'm not arguing that it's inappropriate, they're mandated by law to provide services that are medically necessary. So we're mandated to provide a service that we are underpaid for and then get it's just a nightmare from a business standpoint. And that business, unfortunately, we talk about it that way, but for us to be here to take care of the critical needs of the people of Mississippi, we have to be able to pay our employees. The advancing the health of the medical care system in the state of Mississippi is economic development. We get wonderful headlines every time there's a new steel mill or aluminum plant or any kind of big industry, as we should. Those are great things for the people of Mississippi. But you know what's even just as important? Having a place to get taken care of if you get hurt on the job, or if you get hurt going to work, or if your family member gets sick. Those businesses won't come if we don't have a proper and healthy healthcare system. So our schools are important. There are a lot of important things to make it go. You can't just do the big businesses. Hospitals are massive economic drivers of local economies because of the salaries and the wages and the security that allow people to live there knowing that if they get sick, they can be taken care of. So we got a lot of work to do, and we've been talking about we've been the canary in the coal mine, the State Medical Association, the State Hospital Association. We've been talking about this for years. And I've personally been told, well, just wait for after the next election we can do. No, we've waited as long as we can wait. Now the patient is critical. Now is time to act. Now is time to do something. It can't wait.
So I did a little research. I'm actually moderating a panel discussion on this very topic here in Madison County next week, which will include CEOs of 3 of the local hospitals and Dr. Edmey from the Department of Health and also Tim Moore from the Hospital Association. And just doing some prep on that, I noted that Mississippi has, I believe, the 4th least uninsured population, or we should say the 4th most uninsured is probably the best way to describe it. At about 11%, we're behind Texas, Florida, and Oklahoma, as I recall, all 3 states that have not expanded Medicaid. And, of course, the other thing that I think we've got to factor into this, Dr. Horne, that you know all too well in the trenches, we're the 2nd least healthy state in the country as well, slightly behind West Virginia. So we have an impoverished population. We got a high rate of uninsured residents, and we have essentially the sickest population. That sounds like a dangerous elixir there, a toxic elixir.
This is the forest is full of dry tinder, and we are striking matches all over the place. And the conflagration is going to be ugly. You know, one of the things that people don't often think about, and I've heard an argument made, well, these small rural hospitals, we don't really need them. Those patients can go to the bigger hospitals. Are those bigger hospitals, is St. Dominic's going to put on a new wing to handle all those new patients? They're not. They can't.
Well, they can't get staff even if they did. You know as well as I do. They got beds right now they can't staff.
So we're the same way in Laurel. We could see more patients if we could get more staff. I can't get more staff because I can't afford more staff. I can't afford more staff because the whole system is all messed up through massive amounts of regulation that regulate us into an inefficient position and don't pay adequately for the services rendered. Having said all those things, the loss of these rural hospitals creates further accentuates this poor supply of hospital beds. You lose beds in the Delta. Those patients that can receive, a lot of those patients won't get care, and they'll suffer. Some will suffer grievously and may die. The others that try to get into the hospitals at, say, Jackson or in Oxford, those hospitals aren't going to have the beds. So we run out of ICU beds again. We run out of standard beds. We run out of people to provide the care. We need to take a comprehensive look. We need to A, act emergently to save what we can, and B, have things like this conversation that you said you're participating in the Madison area to get to the root causes of this thing that we've been talking about for years, and we've kicked this can down the road. It's time.
Yes. What about some of the rural hospitals that are, I guess, general purpose or perhaps acute care facilities? What about conversion to critical access hospitals, Dr. Horne? Is that a possible solution to some extent?
It will help some. There are many things that will provide some assistance. That is one that has potential help. There is most everybody if somebody comes to see me and let's say they have a particular medical problem, everybody wants a simple solution. Everybody wants to say, and they don't want to have to change their lifestyle. They want a pill that fixes it, one pill, and maybe not even that. They just want something to fix the problem and not have to worry about it anymore. Unfortunately, there's no simple solution here. So yes, converting to rural access hospitals or converting to critical access hospitals, that's one thing. Fixing the issues with DISH, Medicaid expansion, call it whatever you like. I'm not hung up on the words. I'm hung up on the solution of pulling down the money necessary to lubricate and make the system work. Fixing the issues with insurance companies so that some of their more predatory practices cease, so that they're held to account for how they some of the things that they do, which are just egregious. All these things matter, and all should be done. It's going to take a lot of work. We need to do the immediate work to stave off the death of the patient right now, and then immediately turn our attention to these other matters.
Yeah, so on our C-Spire text line, somebody said paying nurses $80 to $120 plus benefits doesn't help these hospitals. Cries for help. What do you think about that?
Well, we have not done that in Laurel. I know other places have made that decision to do that. So what we decided to do, we did have some surge pay, not those dollars. Your caller is absolutely correct. It's economically devastating to the bottom line to pay those numbers. But some of these hospitals face the choice of, can I get enough staff to stay open?
Yeah.
And to do that, they had to pay those numbers.
Yeah, I've heard it locally, in fact, a lot. So
it was just a terrible decision and position we've been placed in.
Right. Well, we got to go. Dr. Horne, appreciate you joining us today. Very insightful, sir, and I know you're in the trenches. You know a lot about this. We'll talk soon. Thanks.
Thank you so much.
We're coming right back on Midday. Stay with us.